opportunistic infections, and lymphodenopathy fatigue. And then we have integumentary, where there's poor wound healing, skin lesions, night sweats. And then we have respiratory, where we have cough and SOB. And then we have gastric intestinal, where we have diarrhea. Gastric intestinal, where we have diarrhea, weight loss, and nausea and vomiting. And then we have central nervous system, where we have confusion. You remember for the second phase, I said that the patient might have a form of forgetfulness. So there's also dementia, headache, visual changes, personality changes, pain, seizures, and we have malignancies, where we've, like Derek says, we have Kaposi's sarcoma, we have non-Hodgkin's lymphoma, Hodgkin's lymphoma, invasive cervical sarcomas. These are all cancers due to AIDS. And then we have, so for viral infections, we have under immunologic, we have cytomegalovirus and herpes simplex virus. And then for bacterial infections, we have mycobacteria complex and tuberculosis. And then for fungal infections, we have candidiasis and stomatitis, esophagitis, and vaginal. And then we know that for protozoa is pneumonia, basically pneumonia. And the tests that can be taken, just going to list them. We have anonymous testing, where somebody's name is not basically reviewed, and somebody doesn't have to send a name, basically. They just